Assalamu alaikum. My name is Dr. Alruba Taimoor, and I am serving as Assistant Professor in the Department of Physiology, IU Medical College, Ahmedabad. I am delighted to have the opportunity to present my article at this conference. The title of my presentation is Frequency of Aortic Root Dilatation in Patient with Long-Standing Essential Hypertension. First of all, I would like to highlight what is aortic root dilatation and what's its significance in hypertensive individual. Aortic root dilatation is a potential risk factor for the development of aortic dissection, and in hypertensive individuals, aortic root dilatation is being connected to left ventricular hypertrophy, which indicates the susceptibility of cardiac damage. The essential hypertensive individuals are those individuals who are without any identifiable physiological cause, and it accounts for about 80% of those with high blood pressure, whereas remaining 15% are because of various causes of secondary hypertension. In such individual, dilatation of ascending aorta is a major risk factor for the development of aortic dissection and or rupture of the aorta. Aortic root dilatation signifies 50% of all the thoracic aneurysms. Elevated blood pressure remains a continual global issue, posing a significant threat to the global health. Now, coming to the rationale of my study. Previously, various studies have been done in different populations to determine the prevalence of aortic root dilatation in long-standing essential hypertension. But the frequency of aortic root dilatation among the individuals with long-standing essential hypertension has not been proven in the studies which are performed in our population. Therefore, this study is conducted to determine the frequency of aortic root dilatation in long-standing hypertension in our population. Now, coming to the methodology of my study, the objective is to determine the frequency of aortic root dilatation in patients with long-standing essential hypertension. For this purpose, a cross-sectional study was designed, which was carried out in the Department of Cardiology, Ayub Teaching Hospital, Ahmedabad. A sample size of 103 subjects was calculated using WHO sample size software. Non-probability consecutive sampling was done. The subject of either sex aged 30 to 70 years with essential hypertension for more than 5 years were selected for the study, and those with non-hypertensive cardiovascular disease, valvulopathy, and diabetes were excluded. Informed consent was taken from all the subjects. Aortic root size was calculated using two-dimensional echocardiography, calculating the maximum distance between the anterior and posterior aortic root walls, two leading edges at the end of diastole. A parasternal long axis perspective was used to provide longitudinal view of heart from apex to the base, allowing assessment of left ventricle and its outflow tract. Now, coming to the data analysis procedure, the data was recorded on a pre-designed proforma and it was analyzed using SPSS 22 version. Qualitative variables like gender, aortic root dilatation was presented as frequencies and percentages, whereas for quantitative parameters like age, weight, and duration of hypertension, mean plus minus standard deviation was measured. Aortic root dilatation was stratified by age, gender, duration of hypertension, and weight. Post-stratification chi-square test was used, and p-value that was less than or equal to 0.05 was considered as statistically significant. Now, moving on to the results of my study, the mean age of the study population was 51 plus minus 6.7 years. The mean duration of hypertension was 10.7 plus minus 2.9 years. Mean weight was 87.5 plus minus 6.5 kilograms. Male patients were 79% and the female were 20%. And the aortic root dilatation was observed in 19.4% of the subjects. Now, coming to this table, number 1, which shows the frequency of hypertensive patients with aortic root dilatation. Among these hypertensive individuals, aortic root dilatation was observed in 20 individuals, while 83 individuals did not exhibit any aortic root dilatation. Summarizing the results of my study, the frequency of aortic root dilatation was significantly higher in people over 50 years of the age or having hypertension for more than 10 years. That was the p-value was less than 0.005. There was no significant difference between the males and females, and the frequency of aortic root dilatation was more in people who were weighing more than 80 kilograms, but these differences were not statistically significant. Now, this table number 2 shows stratification of aortic root dilatation with respect to age, gender, duration of hypertension, and weight. When the aortic root dilatation was stratified by age, there were two age groups. One was from 30 to 50 years and the other was from 51 to 70 years. In the first group, that was from 30 to 50 years age group, aortic root dilatation was observed in just two subjects, whereas in 51 to 70 years age group, aortic root dilatation was observed in 18 subjects. When the aortic root dilatation was stratified by gender, it was found in 16 hypertensive males and in 4 hypertensive females. When the aortic root dilatation was stratified based on the duration of hypertension, only one subject with history of 5 to 10 years of hypertension exhibited aortic root dilatation, whereas 19 individuals with history of more than 10 years of the hypertension had aortic root dilatation. When the stratification was done according to the weight, only one subject who was less than 80 kilograms of the weight exhibited aortic root dilatation, whereas 19 subjects more than 80 kilograms weight showed aortic root dilatation. Now, coming to the conclusion of my study, the prevalence of aortic root dilatation in patients with essential hypertension is larger than previously reported, reaching a maximum of 19.4%, whereas Cuspidi et al. In 2011 in a study showed a prevalence of 11.8%. Our findings therefore underscores the importance of choosing the most appropriate diagnostic criteria for such individuals, and this is crucial for the accurately determining the treatment strategy for aortic root dilatation. And our results emphasizes the importance of regular cardiovascular monitoring in hypertensive patients, especially those with prolonged hypertension, to detect potential aortic complications early. These are the references of my presentation, and I thank you all for your attention and time. Thank you so much.